asthma is not going to cure your asthma. Now, if you have a mild COPD, emphysema of the lung, because of the history of smoking, it might help in that end. So it can help with some of the lung conditions that are provoked by outside agents, and it can help in the brain. It can help with the Alzheimer's disease. It can help with depression, which is an imbalance in some of the chemical in the brain. It can help with focusing and maintaining good alertness. So you have many, many benefits. It can help the immune system. So you have many, many benefits, but a cure or anything that they tell you out there is a cure, or then you want to like pull back and look again, because there's no such thing out there through in medicine yet.
Could it help with easing the pain in your joints?
It can help with easing the pain in the joint. It does not build up cartilage in the joints. So if we lost cartilage, it won't help with that. But if we lost fluid, because the pain when you have arthritis, when it's mild, it's just lack of fluid. So you have bone touching bone, and that is pain in the joint when you have bone touching bone. So by increasing the fluid between bone, just having a little bit more fluid between bone, that will get rid of the pain. There is another thing called turmeric. Turmeric is a spice, for those of you that have Mediterranean cooking background. Turmeric, and a lot of Indians use turmeric. My wife was suffering from back pain, and we got some turmeric from Whole Food, pure turmeric in capsule. And it helped her so much that I started investigating. So my patient will come in, you will come in and say, okay, what do you want to take? Give me Celebrex. Then your wife will come in and say, why don't you try turmeric? And I will see the result, and I'm getting great results with turmeric, so I recommend my patient for the joint turmeric because it's a good anti-inflammatory. And it's a spice, so you know a lot of women out there that cook, you know, turmeric for cooking. But if you buy it from Whole Food, it's a great anti-inflammatory for joint pain. But again, this is before you lose the cartilage. Once you lose the cartilage, it's those kidneys that are ready to go close to dialysis. You don't want to get there. And the gentleman behind you?
Just want to see if you can recap between omega-3 and omega-9.
Yeah, omega-3 and 9 are important. Omega-6 is the bad one. Okay? And it's not that it's really, really bad, but you will find it in most of the junk food. So you don't have to take a pill that have omega-6. It's a waste of your money. Just with regular food, you're going to get 6. And the problem with the omega is when you look at the ratio of omega, let's say 6 to 9, is that the ratio is 1 to 15. You want to flip that ratio around a little bit. So you want to take the omega-9, the omega-3, you don't want to take the omega-6. Okay? And don't take oil omega once a day. Flaxseed oil, good.
Or you buy the flaxseed and then you grind it.
The grain flaxseed is the best flaxseed.
Yeah.
The grain one. The oil one.
Grain yourself, right?
Exactly. That is the best flaxseed. If you're going to put your money on flaxseed, now flaxseed is very good. It helps you with your digestion. It helps you with your bowel movement. But it helps you with your cholesterol. It helps you control your cholesterol. That's another property of the omega. It helps you with the cholesterol. It brings up your good cholesterol. So the flaxseed, it will help you also bring up your good cholesterol. It helps you with constipation. But don't get the flaxseed, the oil. Get the one you grind yourself. And what I do, I take my oatmeal in the morning, and I take the flaxseed and put it on my oatmeal. If you don't eat oatmeal, then put it on your salad. Okay? I don't put it on my salad because now I just put garlic and olive oil. But I put it on my oatmeal. Okay? But flaxseed is very, very important. It's a good supplement and good for your cholesterol. And you know, I tell my patient, if they come to me and they are taking a pill for cholesterol, I say, you know, for now continue. But let's try the omega, let's try the flaxseed, let's try some form of activity, let's try to follow a good diet, let's try not to eat big meal, once a day, but break it throughout the day, and then I monitor the cholesterol, then I start taking the patient off the cholesterol pill. Now, Harsup always telling you, right, about trying to bring the young Armenian generation here so that we can follow our tradition. The same thing with medicine. If you are overweight, guess what happens with your grandkids? They're going to think it's okay to be overweight. If you smoke, your grandkids are going to say, it's okay to smoke. Grandpa, grandma, they smoke, and they're still alive. So you are sometime, at your age, you can be the worst example for your own family. Or you can be the best. Because if grandpa and grandma, they are always active, they are not smokers, they try to maintain their weight, then your kids that admire you guys are going to learn from you. Just like Harsup said, if they see you coming to church, eventually they will follow you. The same thing if you live a good, healthy life. It's not only important for you, it's important for your family. Because our kids are always looking to learn from us. Any other question? Thank you, Amelia. Thank you so much. Yes?
Omega-3 instead of omega-9 is written there.
Omega-3
I get it.
and omega-9, but no omega-6. Haskazan? Haskazan? Yere? How you say 9? And Hina.
I get yere.
Thank you, Doctor. Thank you for coming. I know you are very busy and you're able to come to speak to us today. Thank you. Next Wednesday, our speaker is Sarkis.